Hey guys, so this is the last day of National Doctors Week, and if you've been joining along with me throughout the week, thank you so much for being here. I've had three fantastic guests. The third one, who you will meet tonight, Dr. Tori Simmons, who is a podiatrist. She'll be joining me shortly. Hey there, Dr. Tori, go ahead and let's get you all set up. All right, so I just accepted that. It may take a little bit to connect.
Hello.
So as I was saying, you guys are going to meet my third guest in just a second, Dr. Tori. She is a podiatrist, but we spoke with Dr. Hawk. Hey there, Dr. Tori.
Hello, how are you, Dr. Covington?
Good. Just making some adjustments. So as we wrap up National Doctors Week, we started off with our plastic surgeon. That video is on YouTube. And then we spoke with Crystal earlier this week, and we talked about mental health and those types of things. And now we're going to talk about feet. So thank you so much for joining me. Go ahead and introduce yourself and tell us what you do.
Sure, I am Dr. Tory Simmons. I'm a podiatrist in the Charlotte area. I work at both Carmel Foot Specialist and Ryan Foot and Ankle as a podiatrist. I have been doing this for about 10 and a half years now, and I really enjoy it. And it's great to be in the Charlotte area servicing the people where I grew up.
Yeah, awesome. And here's a fun fact. Dr. Tori and I went to high school together,
Yes.
but we haven't seen each other in years and years and years and years. So that's pretty cool. We went to Independence. So tell us, what is a podiatrist? What does that mean?
So a podiatrist is a specialist of the foot and ankle. We go to podiatry school for 4 years after college, and then we specialize from day one in podiatry school, meaning we start working and learning on the lower extremity in the very beginning. And at the completion of that 4 years of medical school, which is podiatry school, we then do a 3-year residency, which focuses on foot and ankle surgery, general medicine, dermatology, all aspects of medicine. And then some people go on to do fellowships to learn a little bit more after they complete their 3 years of residency.
Yeah, awesome. So why is this such a big topic? Because I think it's important to remember in weight management that we don't just do weight loss, but we also manage the conditions or diseases related to excess weight, and feet are very much so impacted. So we're going to talk about a couple different things that Dr. Tori sees and her advice for how to make those things better, treat them, or manage them. And let's start with the big one, which is plantar fasciitis. So
Yes.
this is something that I see in my clinic as well. And when we get to a point where I can no longer help, I send them to a specialist. So tell us what plantar fasciitis is and kind of give us a description, and we'll just start with that.
Okay, so plantar fasciitis is when you have an inflammation of the plantar fascia ligament, which is the large ligament on the bottom of the foot. That is typically exacerbated when you are overweight or you've been doing a lot of exercising and physical activity without appropriate shoes and without appropriate support. Being overweight can really exacerbate that because of the additional stresses that you're putting on the foot and the ankle. And that ligament just gets overworked, it becomes inflamed, and then it becomes painful.
Mhm. And a lot of my patients will complain that they especially notice this when they are exercising. And that's so unfortunate because, of course, that's something that we want our patients to do. But when they do it, it's really distressing and causes a lot of pain. So, can you talk to us about why excess weight particularly causes stress in this area?
So that ligament is the largest ligament on the bottom of the foot that supports the entire bone structure of the foot. And when you have excess weight, you are constantly putting more and more on this ligament. So if you can imagine stacking bricks on top of a rubber band and asking the rubber band to support those ligaments, it's just not going to work as efficiently as it should. And the rubber band would get overstretched and overworked, and eventually it would give out. It's the same thing with that plantar fascial ligament, except it takes a lot more stress and pressure for it to give out, but it becomes overworked and you develop micro tears. Sometimes the tears are a little bit larger, than a micro tear in that ligament just from the overuse and from the excessive weight and stresses that are being placed on it.
Okay. So where shall we start in terms of helping these people to feel better? So what would be your advice for a patient who gets sent to you for plantar fasciitis? They want to exercise, they want to hike, they can't, their feet hurt. What would you tell them to do?
The first thing we're going to start with is looking at the shoes that they're wearing while they're working out, making sure that the shoes are supportive enough. There are a lot of different types of athletic shoes out there, and unfortunately, a lot of them are good. Well, fortunately, a lot of them are good. Unfortunately, a lot of them are not good. So you can't go just based on brand. You need a good, stable shoe that's not overly flexible to support your body and body weight. You would also need to look into inserts to help support the foot inside the shoe. So it's not just the shoes, it's support inside the shoe. Once we correct your shoe gear and ensure that you have appropriate support inside of your shoes, then we go into stretching exercises and things like that to help increase your flexibility and make your foot function more appropriately as the lever arm of the leg, if you
will. Okay, wonderful. So you guys have that. It starts with the shoes. And what would you say next?
So after shoes, inserts to support the body, not the Dr. Scholl's inserts. Typically, those don't provide enough support for people that have really severe plantar fasciitis. Those are a good option if you just have a little bit of pain or need a little bit of cushion, but typically you need more support than what the typical off-the-shelf Dr. Scholl's insert can provide. Sometimes if it's severe enough, we also do anti-inflammatory medication, whether that be orally or topically, to treat it. Worst case scenario, we can do steroid injections to put the medicine right there where it needs to go in the foot to help to decrease the inflammation in the ligament.
Awesome. And what do you think about weight loss? So if these individuals lose weight, will that help with the pain and inflammation in that area?
Definitely, it does. The more weight you lose, the less stress you're putting on those joints and the ligaments in the body. So losing weight is beneficial with that. I do understand that sometimes that's the biggest hurdle with working out if your feet are hurting. But sometimes I'll suggest for people to start in a pool if you can. So that way you're not putting as much stress on your body and the joints. And then once you start losing that way, then we can get to more exercises that are higher impact or things on the ground where you can afford to put those additional stresses on the body.
Fantastic. So with plantar fasciitis, do you see this develop as individuals get older?
It can from time to time. Sometimes as individuals get older, the arch can start to fall and decrease in height, which also puts additional stress on that ligament. So it's beneficial to have appropriate shoe gear and support inside your shoes for as long as possible. As long as you're active and moving around, anyone could benefit from just the general principles of wearing supportive shoes and having inserts.
Fantastic. So I just have one more shoe question. Do you have
Sure.
advice on how often people should replace their shoes?
So I would say you at least want to have two pairs of shoes that you can alternate because that's going to allow you to have more time in your shoes. But if you're a runner or a walker, about every 3,000 miles, kind of like an oil change every 3 months, you want to change your shoes out. If the tread starts to wear down and you can look on the bottom and see that it's not quite as thick as it was before when you purchased the shoes, it's definitely time for a new pair of shoes. Or if you notice that whenever you're working out in those shoes, you're starting to develop foot pain and you did not have that pain before, your shoes are definitely worn out and it's time for a new pair.
I like that. And I'm going to repeat that. So for individuals who are very active, if you're a runner or she said a walker, you need to replace your shoes. Did you say every 3 months?
Every 3 months, I'd say.
So that's a lot more frequent than people think, and that's a lot more frequent than people do. And then they have significant foot pain, and that's the reason why we're not replacing the shoes as often. So fantastic. So that is plantar fasciitis. A great segue, you mentioned fallen arches. So you mentioned that those arches can fall over time, and that can put some stress on that fascia. Let's talk about fallen arches. So how does this relate to excess weight?
So with fallen arches, we talked about the fascia ligament, but there's also a tendon on the bottom of your foot that's called the posterior tibial tendon. And that tendon can also get overworked if you have excessive weight on your bones and joints. It causes the excessive weight can cause the foot to not be in a proper alignment, if you will. And so when the foot's not in proper alignment, that tendon's not functioning properly. And so it's working overtime trying to support the arch and trying to hold it up. And sometimes the tendon just gets stretched out. You can get tears and things in the tendon, and you develop what we call posterior tibial tendonitis, which results roughly in the arch falling because that tendon is no longer supporting the arch of the foot.
That sounds painful. That doesn't sound fun. When we hear itis, we think about inflammation and pain. So if someone is experiencing fallen arches due to weight, is that reversible?
It can be depending on the degree of the fallen arch. If it's just due to the tendon being a little bit overworked and that arch is starting to collapse, sometimes we can help that with, custom orthotics or bracing if necessary. Sometimes we can strengthen that tendon. In worst case scenario, there are surgical procedures to help correct it as well.
Okay. All right. And how do we manage or treat that?
So typically we will start out if it's something that happens all of a sudden, say you are working out and you're getting into the groove of things trying to lose weight and all of a sudden you have a fallen arch, typically that's due to that tendon. So we would immobilize you in a walking boot initially. After that, we would work on strengthening that tendon and then look into some bracing to give that tendon adequate support.
Okay. Awesome. All right. Is there anything else you want to comment on with that topic before we move on to arthritis?
No, I think we covered everything with those two.
Okay. So let's talk about arthritis. It can happen all over your body, but today we're talking about feet. So explain to us how that would present and what someone would experience if they're having some arthritic pain in their feet.
So arthritic pain in the foot occurs when the bones are not properly aligned. Each bone has different surfaces and moves in certain ways. And when you have excessive weight, you're causing those bones not to sit as they normally would in the foot. And so anytime a little shift in the bone occurs with where it's supposed to be, or if the joints are not aligned properly, and then just the overuse and the malalignment of that joint over time can cause arthritis to develop in those joints just from them not moving the way that they should. And so typically that goes back to support as well, adequate support in the shoes. If there are things that develop, such as bone spurs, which can develop just from the inadequate and inaccurate movement of those bones in the foot during the range of motion. When you are walking, your foot goes through a certain progression. And so if you have forces that are being placed on the foot from arthritis that are being there because you're overweight, that can result in bone spurs just from that movement. You can get bumps and lumps on your feet that are caused by bones. So sometimes that is also help with injections and surgery to get rid of those bumps that are causing the pain, because we don't want them to cause ulcers and things down the road. But basically, once you start to lose weight, it helps take some of the pressure off of those joints and helps them to get back to their normal alignment, which can in turn help to alleviate some of that pain and discomfort.
That's awesome. So would you say that prevention is, one of the keys to not developing those joint issues before they happen?
Definitely. I know that shoes are slowly changing to become more supportive. And so I think as people start to realize, especially with the pandemic, a lot of people have not been wearing the high heels and things quite as often. As shoes become more supportive and we start to transition to wearing, yeah, and we transition to wearing better, more supportive shoes, I think that will definitely make a difference for a lot of people, because when we have on shoes that provide adequate support, our feet are aligned properly and that can prevent those arthritic types of pain.
Okay, I like it. So again, a great segue. With heels, there's this area in the ball of your foot that can become painful, and that area may become more painful if there's excess weight. What is that ball of the foot area, and what is that painful thing that people can sometimes experience?
So typically the pain in the ball of the foot is bunion pain, especially if it's right in the area of the big toe. Um, and that happens when there's this excess pressure or excessive pronation, which can be caused from excessive amounts of weight that cause that first metatarsal bone, the big long bone in the foot, to not be aligned properly. And when that bone is not properly aligned, you have some imbalances in the muscles and tendons of the foot that can cause the big toe to kind of move over a little bit closer to the second toe and cause that bunion to form.
Oh goodness. Okay. So what do we do about that?
So typically, conservatively, bunions are treated with wearing appropriate shoes. So you don't want to wear a shoe that's really narrow or putting excessive pressure on the side of that bump. Sometimes if the arthritis develops in the joint from the bunion deformity, we can do injections. Um, it can also need surgery depending on the degree of the deformity.
Okay. Awesome. So this is a more practical questions, but corns and calluses and those types of things, do you see those more commonly for individuals who are at higher BMIs or higher weights?
Not necessarily. Those are pretty consistent across the board. Weight doesn't contribute as much to those. You can still have them because of the excessive weight, but I would not say that just because you are overweight, that's why you have corns and calluses. People get those all the time just from having bony prominences or ill-fitting shoes.
Okay. And with the corns, especially, there are different solutions that you can get over the counter. Do you feel that those are adequate or that they actually work to remove those corns, or do people need more, specialized care to remove those areas?
I would say you always want to start with padding the area. So you will see the like the corn pads that look like little oval donuts. Those are fine to take the pressure off of the area. But when you start using the corn remover pads that have the chemical and the acid in them, you have to be really careful with those because they can remove too much skin and cause you to develop sores, which can become infected and cause a bigger problem.
Wow. What about the pedicure lady that's scrubbing, the corns and those things? Do you feel like that is appropriate, or is that not a good way to treat that?
You have to be careful with the pedicure lady. Depending on how they clean their equipment and what they're using to scrub your corn, they could cause more harm than good, especially if they cut you and they've used that file on someone else who may have fungus or wart or bacteria that can now get into your cut and cause you to have a sore or an infection. I always recommend, going to a podiatrist to have an exam first to determine if there's something that can be done and see what we suggest based on your individual need before relying on the pedicure lady to take care of your corns and calluses indefinitely.
I will agree. And I'd also add hepatitis.
Yes.
Hepatitis C, which is not treatable or curable, can also be transmitted through those tools. And if you're diabetic, then your feet are very, very, very sensitive, and we want a professional to be working on your feet as well. So I totally agree.
Yes.
Well, we are going to wrap up in just a second. We will take one or two questions from the audience if there are questions related to our topic on feet today. But as we wrap up, is there anything else that you wanted to mention related to feet issues that you see for individuals who may have some excess weight, or anything that you want to comment or add?
I would say for individuals with excess weight or really anyone, you don't have to be in pain. So if you've tried everything, you've gone to Dr. Google can't help you, you're still continuing to have pain and discomfort, definitely seek help sooner rather than later because it's a lot easier to treat things in the early stages than after they've been going on for months and months and months because it can take time to get better. So it can take you that much longer to get better if you wait and put it off seeking care.
That's right. And that's for anything across the board in the medical field. Do not wait until you're on your deathbed to ask for help, because then it's a lot harder to treat you and get you back in the right direction. So I agree 100% on that. And weight. The longer people are a certain weight, the harder it is to lose it. So don't wait
Mhm.
until it's too late to deal with that on your own. Are there any questions? Move quickly. Okay. All right. So, Dr. Tori, let us know how to find you, the name of your office, any specials or office information that you want to share.
Sure. So you can find me if you go to the Foot and Ankle Specialist of the Mid-Atlantic page. I am listed there under Dr. Tory Simmons. You can see which locations I'm working in and which days. The Carmel Foot Specialist office that I work in, we have two locations, one in Pineville, that is 5 minutes from Atrium Pineville, and then one on Kings Drive or off of Kings Drive that is near Atrium Torrance. Then I'm also at Ryan Foot and Ankle in Harrisburg, North Carolina. So Foot and Ankle Specialist of the Mid-Atlantic, that website will direct you to the link to schedule an appointment with me.
Okay, awesome. And we did have a question. Are there any exercises I can do for my arch? If you're still here, I'm not quite sure what she means by her arch, if it's fallen or too high or what. But if you're here, give us more insight on that. But I'll let you go ahead and take that question, Dr. Tori.
So, exercises and things you can do for your arch include strengthening and increasing the flexibility in your calf muscle. When your calf becomes more flexible, it helps your foot to function better, so you have less stress and pressure, less stress and pulling of the ligament on the bottom of your foot, the plantar fascia ligament, which typically causes arch pain. So that's the main thing that we stress is stretching that calf muscle.
Okay. And she added, I get pain after exercising sometimes. Okay. Yeah. And
I
I
would
put in the
check the shoes
description.
that you're wearing. Yeah, make sure you're wearing good supportive shoes.
And I put in Dr. Tori's description that she has a degree in kinesiology. So, talking about strengthening other parts of the body and muscles, she knows all about that. So, thank you for your question. All right, guys. Well, thank you so much for joining us. And that is a wrap. I will see you guys around on social media. Have a good night. Thank you, Dr. Tori, for joining
Bye,
me.
you're
Uh,
welcome.
see you guys next time.